It's another day with the physicians where your health is our business.
With growth spot with egg. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the Training Culture of your regular program.
During the pandemic, a lot of people suffered because of lack of information. It's one thing to have information, it's another thing to have the right information that is based on facts and based on evidence.
When pelvic muscle, tissue, and ligaments weaken, the uterus can drop down into the vaginal canal, causing uterine prolapse. Nearly 1/2 of all women between the ages of 50 and 79 have some degree of uterine or vaginal vault prolapse or some other form of pelvic organ prolapse. Factors that increase the risk of uterine prolapse include childbirth, age, obesity, chronic constipation, and having a hysterectomy. Many women with uterine prolapse have no symptoms, but if symptoms are present, they may include bulging in the vagina, feeling pressure in the pelvis or vagina, and lower back pain accompanied by bulging in the vagina. There are actually no definitive way to prevent uterine prolapse, but when you watch your regular program, The Physicians, the guest is going to be able to profess some things that you need to do to be able to keep alive and stay healthy with uterine prolapse. On your regular program, The Physicians, we shall be discussing uterine prolapse, the symptoms, the risk factors, presentation, and management. Stay tuned. It's another day with The Physicians where your health is our business. Today we'll be discussing uterine prolapse. Actually a medical condition for women that is actually threatening, that they don't like to hear about. But well, on your regular program, The Physicians, we always want to bring in the best so that you can learn more on how to cope with some of these medical conditions. My name is Dr. Martina Agbirian, and I'm not alone on this program. I will be my co-hosts.
I'm Dr. Memuna Yusuf Kadri, and of course, on The Physicians, your health is our business.
Well, we're talking about uterine prolapse.
Yeah.
It's something that, apart from the elderly ones don't feeling okay with it, even the younger ones, before they get older, it's something that they dread, especially when you are in that childbearing age. You must have known so much about it. Yeah. And I had a very pathetic case when I was in hospital some time ago. This lady came, and you know, she had to wear diaper, and she said something was coming out. By the time we examined her, there was the uterus staring at us. Yeah. It was actually a prolapse, total prolapse.
There was this case I think really can still relate with and resonated with a lot of us that were in that team that period. Had the baby, had a uterine prolapse, and she was served a divorce letter while he's still in the hospital. The
husband did that.
Yeah.
I think that has to do with ignorance, really.
And despite everything to make him understand that, there's treatment, this woman will be fine, we need this psychosocial support from him, you can't just abandon her just like that. She was still quite young.
Yeah,
for him, I'm done. She brought it upon herself. There was just a lot of ignorance,
exhibited.
And there was not, and this, we are not talking about, so a lot of times when things happen like this, you just think that the person is an illiterate. We have quite a number of educated illiterates. He was very educated. He understood that something like this could happen. Flyers, my consultant did the whole lot. The professors, had a meeting, family meeting, brought him, brought her family, brought his family. All that fell to death, yes. At the end, she was discharged to her family. At least she's alive. Baby is alive. The other children she has, they are alive. And I'm hoping she has gotten herself back and moved on, and healed and moved on.
Well, that's why we are the physicians, because we always want to bring the best and talk about very, very important topics.
Yeah.
Uterine prolapse is something that everyone should know about. Whether you like it or not, one of the risk factors, at least that we know, is childbearing, childbirth. So every woman is at risk.
As far as you
As far as you have childbearing
and you
age,
desire to have a child,
you are at risk of having a uterine prolapse. Well, we have a guest, a consultant who is actually well schooled on that field, to take us on uterine prolapse. We'll be back after the short break. Stay tuned. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We're going to be discussing uterine prolapse, the causes, the risk factors, and of course the management, if possible, complications. And we have our guest, the consultant, the MD, CEO. He's actually a consultant obstetrician and gynecologist. He's the MD and CEO, LOUISMED Specialist Hospital. He is Dr. Anthony Akiloye Bamigboye. Prof, you're welcome to our program.
No, it's nice to be with you, my host and co-host.
You're welcome, sir.
Doctor and Dr. Martina and Memuna. Yes.
It's nice having you again.
Nice having
So
you.
now we are going to be talking about uterine prolapse. Uterine prolapse. Do you want to give a general overview so that we can, the viewers out there will be able to understand where we are going? General overview. The uterus, its location, then what is prolapse? What does it mean?
Thank you very much. Prolapse is a condition where the organs are not found in the specific area that they are supposed to be found. The site is dislodged. In the pelvis, we have the uterus, we have the ovaries, the fallopian tubes, and the vagina. So any of these can drop outside of the vagina or within the vagina, then we call it a prolapse.
Okay. So it's like, so now the uterine prolapse is actually the uterus in this situation, and that is now dropping from its location.
Exactly. When it drops partially, it's within the vagina, and then when it drops totally, and you are seeing it outside, the one that doctor described earlier on, then we have a procedentia, it's called, or a total one.
So that is, so you have a classification for uterine prolapse?
Yes.
You want to go through that again?
When the uterus is found, or the cervix is found in the vagina, dropping like the first upper third, we call it minor. Then when we have the cervix or the uterus dropping outside of the uterus, outside of the vagina, we call it procedentia or total.
Okay.
And that could be worrisome, is the one that you saw when you were in your internship, and you saw the uterus out. It's called procedentia.
Okay.
So what can lead to uterine prolapse?
There are quite a lot of things that can lead to it, but the most important ones are childbirth. Childbirth is a very big factor. It is actually a sine qua non of prolapse. The more kids you have, the more the chances that you're going to have a prolapse. That is confirmed. Apart from that, you have genetic tendencies. A woman who has got problem with connective tissue in her parents will also have it with her, or may also have it. So it's a risk factor. Or funny enough, again, a woman who smokes will have a problem with the connective tissue. So the organs are not held in positions.
Place.
So you have it descending and you're having a prolapse. A woman, again, who is obese. Obesity is a problem. Everything we have been discussing in this forum has always dealt with obesity. So a woman who is obese will have a prolapse. And most importantly, the iatrogenic ones. So like prolapse again could be grouped into iatrogenic ones and non-iatrogenic. Iatrogenic in the sense that it's the doctor who is causing it.
The doctor is the one
Doctors causing the prolapse, yes.
Prolapse, okay.
Yeah.
So
Most of we doctors do not want to accept it, but this is a fact. We rush to do hysterectomies. Okay. And when you are doing hysterectomies, it has to be modified most of the time.
What is hysterectomy?
But they don't do it. We remove the womb, we take out the cervix, the old womb, everything ovaries out. But it's not supposed to be like that. It's only when there's a disease entity in the cervix that you must take it out. That's the one we call subtotal hysterectomy.
Okay.
Subtotal hysterectomy is very important for our doctors to know that it's not all the women that must have a total one. The cervix holds the bladder in place. So those ligaments holding those bladders, you've taken them out when you are doing a total one. So I then advise, if you have a normal pap smear and the woman is educated enough, there's no need to remove the cervix. Apart from the intimacy, you have a cervix, the sexual intercourse, the way you enjoy it is far better than when the cervix is taken out. So I will enjoin my doctors at home who are listening that if you do not have disease entity in the cervix, don't do a total hysterectomy. Because back to the topic, prolapse can occur. Prolapse of the vaginal vault can occur in a woman that has gotten the cervix taken out. Yeah.
what about the women that have big babies?
Thank you, doctor. Big babies is a problem. We do not want our women in labor to have babies that are more than 4 kilograms. But they do have that. When they have that, they run a very high risk of having prolapse of the uterus. And not only that, a woman who has got even a small baby but difficult labor, prolonged labor, yes, the one we call TPD, whatever that means, capillopelvic disproportion, they will have their ligaments stretched in an attempt to push out the babies. So we're going to have prolapse.
So that means that vaginal delivery is a major risk factor.
It's one of the major risk factors.
How about menopause?
Menopause, the older you become, the more the chances that you can have prolapse. Yeah.
Well, is there any racial differences? Africans more at risk, or Caucasians more at risk of
there are always conditions whereby we tend to believe that the Caucasians are more at risk.
Why?
Because somehow their pelvis, which is wider, yes I know, but they still have these soft tissues. And if you have soft tissues there, you are more at risk. Whereas in Africans, because we carry a lot of things on the head, we bend down, KGS exercises. That would prevent, only we are preventing it. The sun rays, the vitamin D's and so on and so forth, makes our tissues to be stronger. Then you're supposed to have a lesser occurrence. However, the health conditions and the health systems in Africa will make you to be more predisposed. So at the end of the day, the balance is scary, whereby you have even women in Africa having it. That's why we are here to discuss this
the
topic.
Health system in Africa makes one more predisposed.
Yeah.
So it's not
exactly
being an African. Well, Prof, just hold it there. When we come back, we'll discuss more on that aspect. Let's keep a date with the physicians. Let's hear what you have to say about uterine prolapse. We'll be back after this short break.
No.
Yes. I think it's the wall of the womb or something like that.
It has to do with either the bladder or the uterus.
A common disease that affects women, maybe during childbirth.
I don't know.
Probably when a woman holds urine longer than expected.
Like maybe a woman during childbirth and too much coughing.
I think women.
Ladies who are not of age, like too old.
It affects mostly the women.
Welcome back. If you have just joined us, you're onto your regular program, The Physicians, where your health is our business. We'll be discussing uterine prolapse with our consultant here, Professor Anthony Akiloye Bamigboye. He has actually been telling us so much about the risk factors. He made mention of obesity. Obesity, again, is here. Of course, he talked about smoking also, and being a woman that desire to have a child. They are also at risk of having a uterine prolapse. And of course, also talked about menopause. Now we want to know more about it. Let him tell us more about how this can present a woman who has a uterine fibroid. What can be apart from the risk factors that you have mentioned, what other things do you have to tell us before we go straight to the symptoms? How do they present in hospital?
Well, most of the time, the woman may come looking big. When a woman looks big and she says that she has difficulty in passing urine, or there's a change in bowel habit, or she's micturating anyhow, which means she's leaking urine, then we must start thinking that there must have been something wrong, like a prolapse. So I would say that they will have this feeling of heaviness in their pelvis. Okay. When they have this feeling of heaviness with a bulge, they can tell you that they put their fingers in and they felt a bulge.
Okay, you feel something
coming.
There.
Yes, when they complain like that, then you have in your mind that this could be a prolapse. Then they may come up with the story of not being able to pass through properly, constipation at the same time. That's when we have what we call a rectocele, which is part of the pelvic organ. Then when they are not able to pass urine, then we have what we call cystocele. It's a descent of the bladder. And then when they've done hysterectomy, it is the vaginal vault, the one that you left behind, that is trying to come down. Okay. And you have a prolapse of the vaginal vault. Okay. And then, of course, I've seen, very rare indeed, that I don't think many people have seen it in life before, but I've seen a case where they did a hysterectomy, and it was the ovary that was prolapsing, ovary.
All
the way up there, down into the vaginal canal. So then we have that, and that could be very painful because pressure on the ovary can twist it, and they can feel a lot of pain.
Yeah, because of the fallopian
tube. Exactly. So yes, that when you leave the ovaries behind, try to, which is good. I'm not saying it's not good, it's very good. But if you make a mistake and you have not closed properly the vault, or there's weakness of the tissues at the vault, then it would descend.
Women sure have some challenge.
No, they have. That's why they always say gynecologists have no retirement age. Because I thought I've left job, but now I'm back at it again.
And working, because there's the early teenage, puberty, childbearing,
menopause, postmenopause. There are always problems.
There are always problems.
Yeah.
So before we go into management, I know management is not just treatment. Can we look at this two-pronged approach? What are the preventive measures, and how can we treat uterine prolapse?
Yes, prevention is better than cure. That is the idiom. We got to prevent it by ensuring we do not have too many babies. Okay? And we must ensure that we do our sugar test, the glucose test, when we are pregnant, to ensure that we don't have big babies. That's true. We must run away from smoking cigarettes. because it's a risk factor. We must ensure that we do not have this tendency of overweight, eating nicely. Ensure we do exercise, our regular walking and Kegels. Kegel exercises is when you strain and tend to pull your navel backwards. Kegel. Those things can help. You can prevent. And of course, the other ones you cannot do anything about your connective tissue, which is the genetic, apart from not having too much babies.
And the treatment?
The treatment will be with what I've described. The exercise is the paramount. Exercise, you do a Kegel. Everybody could be helped by doing what is supposed to be done, especially when the prolapse is not major. You can do exercises, the Kegel, the pelvic bones or the pelvic muscles, try to strain them. They will teach you in your clinic what you should do. Then apart from the conservative treatment like that, we can also use what we call pessaries. I have patients in my clinic that are only on pessaries now. Maybe for the last 25 years, I put them on pessary. The pessaries are not impregnated, are doused with estrogens. You insert it to push the pelvic organs up, and then you put the pessary in. And that alone can assist us in preventing the organ from falling down. That is done. Then apart from that, we then go for the surgical approach. The surgical approach is to fix the vault that is falling down. You anchor it into the sacrum, into the pelvic bone at the back. So you can do that. Then you should also ask whether the woman wants to be sexually active or not. A woman who is old, 75 years old, not interested in intercourse again, you can close the vagina. You put your organ that is prolapsing backwards, then you close the vagina, and then it means she's not going to have.
Psychologically, you don't think it will affect her?
That is a woman who knows that she's no longer going to be active. So that could be done. But that is the worst operation that we do.
Are there possible complications
for
you have a uterine prolapse?
Oh yes, there are a lot of complications. The first one, let's start from the bladder.
Okay.
The bladder is falling down. If the uterus falls down, the bladder must fall down. That one we call it anterior cystocele. The bladder comes down, and then when you have anterior cystocele, you can have UTI, infection of the bladder. You can have incontinence coming with it. Then when you are not even going to be able to have sex. So when that comes up, also is a complication. Then also if the descent is on the posterior side, which means in the area where the cecum is, the intestine, that can cause constipation, interspersed with diarrhea. And some people will think it's a irritable bowel syndrome, but it is not. It's because of this coming down. So the woman may not be able to go to the toilet to pass stool. So that is a complication again, and of course the psychological aspect of it. Yeah. When you don't have a functional, or can I say, a good pelvis, the organs are falling below. The husband is not interested, is running away. Your home is disrupted just because of a simple thing that you could have treated with pessary. So that is one, and there are many other things.
Complete marital discord.
Yes, there will be marital.
Like the one we talked about, that the husband has to give a divorce.
Exactly. Okay. So, we do have cases like that, whereby a woman comes to me and says, Professor, I have an issue with my partner. And then I ask why. It doesn't touch me. Then you inquire more, what was the problem then? And the answer will be, because of something coming out. Yeah. We examine a prolapse, which we could easily treat. And when I put my pessary there, they go home, they come back again, 6 weeks time. Things are good. So that's why it's important for us at home to know the importance of prolapse.
Wow. You've actually done so much on this topic. Thank you so much. Thank you so much for coming on our program, and I'm sure when we call again, we'll still respond. You've actually talked so much about uterine prolapse. I'm sure our viewers out there, you heard so much from what he just talked about, the uterine prolapse. It's as a result of weakness in the ligaments, the muscles that actually hold the uterus. So there's a drop. The uterus leaves this position and comes towards the vagina. For women, you can do that today. Check yourself. So when you're having a bath, just put your hand down there. Put your hand in. If you're able to feel something that is soft coming down, that is soft, that you can palpate it, then it's likely to be your uterus. Seek medical counsel. Go and see your doctor so that they can examine you properly and tell if it's a prolapse or not. You don't have to wait until it becomes a total prolapse. Some of the risk factors he talked about, obesity is a risk factor. Taking cigarettes, smoking is also a risk factor. Why don't we try as much as possible to also exercise? There are certain exercises that you can also do to help it. Then multiple births, obese babies. So when you are pregnant, manage the kind of things that you also take. Well, thank you so much for being part of our program again. And we'll always be there for you because your health is our business. Till next time, stay blessed. I'm Dr. Martina Agberin.
Thank you very much, everyone, for keeping a date with us as always, and it's always a pleasure, coming on board every time we have to be here. Uterine prolapse, you've all heard from the prof, and you've heard all our discussion here. Being fat, smoking, multiple babies. Please, as much as possible, just make sure you screen for diabetes. Make sure you go to the right healthcare center that will help you in case there's any issue. Please don't forget to follow us on all our various social media platforms, Instagram, Facebook, Twitter, and YouTube page, which has all the other previous episodes which you can binge watch on. And if you want to be a part of this program, you are just a click away. My name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
In Nigeria of today, orthopedic surgeons remain the bedrock of the management of musculoskeletal conditions, including fractures and any other associated bone and skeleton injuries. However, I believe that there's still a role for the traditional bone setters, as long as they understand the need for a structure, for education, for formal training, and we should be able to inculcate them into the primary healthcare system to offer much needed service to our patients. For more information on these and similar other medical issues, keep watching The Physicians.